Good evening, good evening. My name is Lisa Lane, and welcome to our second episode of DVT-TV. I'm sorry, I've been in the car all day, so I look a hot mess, but please forgive that. Tonight's episode, you're going to see an extremely amazing story from an extremely amazing person. Sarah and I met while I was in Washington, D.C., Capitol Hill Day for the National Blood Clot Alliance. And instantly, I, and our friend Jakara just became extremely good friends like that. It's not easy to find people who can kind of commiserate with what you've been through with blood clots. I'm not going to take up too much time talking tonight. This is her story. I am so grateful to Sarah for sharing this with you all, with the world. I am so proud of her. A couple of things that you'll hear in common from my video and then with her video. You're going to hear about misdiagnoses. That is very common with blood clots, especially with young people. Sarah was 30. I was 25 when we were diagnosed, and the thinking automatically is that this is a young, both of us were athletes, young, athletic, healthy person. There's no way that it could be this. And it is. So the common theme of blood clots can happen to anyone, anywhere, at any time. It does not matter. Now, there are things that you can do to put yourself at higher risk. Smokers, sedentary lifestyle, long trips in a car or a plane without walking around. Those kind of things can definitely add to your risk of having a DVT or DVT blood clot or pulmonary embolism. However, there's a lot of people that don't do those things that develop blood clots in their lifetime. The second thing that you're going to hear is about medication. Just like with diabetes, just like with acne, just like with mental health, a lot of times people who are affected by those things, it takes several different medications to get on the right regimen. So, both her and my story say something about that. The problem with blood clots and DVTs and PEs and VTEs, the problem with all of this is that right now there are only, on one hand, different treatments, 5 different options that you have. 3 pill form, 2 injectables. So in terms of medication, you've got a small list. And if you fail a medication, every time you fail, that list gets smaller and smaller and smaller. And that's one of the reasons that we are fighting. This week, I was named a brand ambassador for Eliquis, something I am so excited about, because these are the things that pharmaceutical companies need to hear from the survivors. Is what if it doesn't work? What's next? Sarah is an amazing advocate from the Virginia area. She advocates a lot for women's health rights, where I, on the other hand, advocate a lot for legislation for monitoring and surveillance. So we are both advocates. We both have our kind of niche. But I am so excited for you all to hear her story. I am so incredibly thankful to her. As we go on, we will have more survivor stories. But I think Sarah and I, if we could tell you anything, it is that advocate for yourself. If it doesn't feel right, keep pushing until you get the answer. But that also, we are both just grateful and thankful to be here. As she says in her video, there's thousands of us that aren't here to fight. So those of us that have made it, some of us have felt the need to fight for this and to fight for others that may go down this road. Maybe they'll have an easier time. You know, it's something that you don't want to go through, but if you go through it, help somebody else. So again, if you have a story, please comment, let me know. I would love to hear it. Something that I did this weekend, I'm going to mention really, really quick, and then we're going to get to the story. But it gave me a wonderful idea. I went and saw my family this weekend, which was so needed, so incredibly needed. And my dad and I went to a CITO event, CITO, Cash In, Trash Out event. And it gave me an amazing idea to do an Adopt a Highway program for blood clots. As a great way to bring awareness. Every time people drive by that sign, they'll see it, they'll be reminded. And so be looking for that, because that is my next step. I've already got the applications out and I am ready to go. I'm ready to name a highway and start, doing something, anything we can do to bring awareness or visual, to blood clots. So I want to say again, thank you all for your support. Thank you all for the amazing feedback after the first episode. It's almost at 150. The last time I looked, 150 views. So you all are incredible. If you would, please hit that subscribe bell. And I'll be sharing this out to all my social media. So this is Sarah's story, and this episode is called Who?
Hey guys, welcome. Thank you for listening to my story today. My name is Sarah, and I'm going to share how I learned about my DVT and pulmonary emboli diagnosis. And today I'm also going to talk about how that has affected me over the years. So about 10 years ago, at the age of 30, I'm 40, I just turned 40, I learned that I was diagnosed, and at the time I was an avid marathon runner, so I had ran a couple marathons at this point, and I was training for another marathon that was coming up, and I ran 6 miles one day, and my friend invited me to go to the zoo, and our daughters at the time were probably around 7 or 8 years old. And when we were walking, I noticed that there was a sharp pain in my buttocks area, and I informed her that I probably should sit down for a bit, and maybe I had overexerted myself from the run, the day before. And so we sat down, and as the day progressed, I noticed that it didn't get any better. So I went home, I stretched it out, I thought nothing of it, I thought, maybe it was just, something that happened from running too much. And as the week progressed, I was going to work every day, and when I would go in the office, I would go and get ibuprofen and keep popping that, thinking, you know, maybe I need to just slow it down and take it easy. So I went to the zoo. This was February 2014 when this had happened. I went to the zoo on a Sunday, and by Thursday, it got to the point by that night that I could barely walk. So at that point, I was like, oh my God, I need to make a doctor appointment. And if I don't feel, you know, well in the morning, I'm just going to go to the ER. And so the next morning, I was in excruciating pain, decided that instead of waiting for my doctor appointment, I would just go straight to the ER. At the time, I was under military insurance, and so I went to a local base, and I was seen by a couple nurses, and they didn't think anything of it. They didn't ask me any of the questions that you would normally ask if someone you suspect has a blood clot. So I sat in a room in a hospital gown for a few hours. I was there probably from 7:30 in the morning until probably 1 or 2 o'clock in the afternoon. By that time, I looked at my leg and noticed that it was starting to turn blue. And I asked the nurse, I said, you know, my leg's turning blue. What is going on? And immediately she called one of the doctors, and 3 doctors immediately came into my room and looked at my leg and said, we need to take her in, and she needs to get a Doppler ultrasound and see if there's a blood clot going on. And so I had never really thought about blood clots before this. We don't have any blood clot history in our family, so this was something that had never occurred to me. I didn't know what the signs would be prior to going to the ER. When I got wheeled to the room to get a Doppler exam, when the technician was pressing down on my leg to try to get a reading on and to see if there were any blood clots, he barely pressed down and I was screaming in pain. It was just so painful. And I wouldn't say I was screaming, but I was like, it was just so painful. Just putting like one finger on my hand was just so painful. And so he ended up confirming to the doctors what the doctors had suspected, that I did have a DVT. This was, to them, when they saw me afterwards, they said this was the largest DVT they had seen on a patient in their career. My blood clot was from the top of my abdomen all the way to my foot. So it had covered, it was just one very large blood clot. There was no lots of blood clots in my legs. No, it was just one large blood clot in my entire right side of my body. And so then they decided right then and there that I needed to go to Walter Reed, which had a lot more resources than the hospital that I was at. And so they sent me to Walter Reed, and from there, the surgeons decided the next day that I was going to have an emergency surgery to try to break up the clot. The next morning was a Saturday, so Thursday could barely walk. Friday went to the ER, was in a lot of pain. They gave me morphine because I was in such excruciating pain. Just touching my leg barely was unbearable. And then Saturday at 6 o'clock in the morning, they wheeled me to the operating room to start the angioplasty and to break up the clot. The surgery lasted about 3.5 hours. However, it was not successful. There were several blood clots that broke from the DVT in the leg and had escaped. And at that point, they said that my life was more important, and it was indicating when I was hooked up to all the machines that there was a good chance that I could have died that day. So they stopped the operation, and they instead decided to insert a vena cava filter to prevent any blood clots from going into my heart. So they did that. I was in the hospital for a week and a half, and I could not walk. When I did walk, it was very, very difficult. I was in so much pain. The pain was unbearable. When I left, I had to go to physical therapy, which I had started while I was in the hospital. The physical therapy lasted for about almost 2 years. So I'll backtrack and say what happened after I left the hospital. So when I left the hospital, they said that I had my leg was so swollen. I had post-thrombotic syndrome, which basically means that my leg was swollen and was affected by the blood clots from the DVT, and a lot of the veins in my leg were affected and it would never go back to being normal. And I'll come back to that later on in my story. So the blood clots ended up, they were still in my body. We were trying to figure out, like, okay, why can I not, walk without a walker and a cane, which I had to use for almost 2 months. During this time, I had to work from home because there was no way I could drive. It was my right leg, and I was in pain, and I needed to stay home to get better. So I ended up going to physical therapy every day to try to gain more strength. It was very, very difficult trying to gain strength, not only in my leg, but also in my lungs, because it originally was very, it wasn't noticeable whenever I had the pulmonary emboli, and they think it was because I'm a runner, and that's why I didn't notice that. So that makes sense to me because I ran a lot, and so they said, maybe that's why you didn't notice that you had trouble breathing, or maybe you're taking shorter breaths or whatever the case is. I didn't notice it until they took all the imaging and everything, did the CT scans. So I ended up going through physical therapy, and in that time frame, the doctor that I was seeing inserted the vena cava filter, and then he removed the vena cava filter after about a month, so I had another surgery. And then during this time I was taking Coumadin, which, by the way, wasn't working for my body. My body was not regulating it at all. The surgeon was like, okay. And at the time, I don't think we had Eliquis. I don't think Eliquis was out yet. I'm not sure, but that wasn't an option that was given to me. And so kept trying, and my levels kept going up and down, up and down. So it was either my blood was either too thick or too thin, and so it was just a major problem. And I kept following the rules, but it was never working out for me. So then they switched me over to another drug, and I don't remember what that was. It was another blood thinning medication, but that didn't work. I don't know if I had some kind of allergic reaction or what, but they took me off of that immediately, and then tried something else, and then eventually they put me on Eliquis. So in that time frame, my leg was swollen. It was probably 2 times the size of my leg, what it originally looks like. And so for it to be 2 times the size, I could not wear pants. None of my pants fit. So it was a struggle. I was always in leggings, which I love wearing leggings, but to wear leggings every single day, and you also, oh, and by the way, not only did I have to wear that, but I also had to wear these compression stockings. And it was the tightest compression stocking. So after surgery, after not being able to walk for a while and being out of breath and everything, it would take me, I promise you, it probably took me like an hour every day to put those pantyhose on, like, well, compression stockings on. So I put those things on, and it was like, I mean, by the time I was done pulling that crap up, it was like a workout in and of itself. Like, I was sweating, and yeah, it was nuts. So I ended up, after that, after the doctor removed the vena cava filter, he removed the vena cava filter after a month. Then he said, okay, well, your leg is really, really big. We need to do something about it. So he said, let's schedule another surgery. This was in August of the same year that I discovered I had a DVT. So he said, let's do another surgery. Let's try to do an angioplasty again and see if that works. He tried doing it, and it did not work. So his method of the way of him doing it, it just didn't work. And I was so frustrated and so let down by being told that basically at the end that there is really nothing to do. And I kept asking, well, is there any way we could reach into other networks? Is there any way we could talk to other doctors? Or do you have any other doctors in your network? Can we talk to doctors in other hospitals or anything like that? And I felt like every time I asked that question, I hit a brick wall. I still feel that way even as a woman. when I ask questions to healthcare providers, I feel that women are often not heard, and that is something that I'm very passionate about. We are kind of brushed aside. It takes such a long time for us to figure out our problems. And, you know, I understand like medicine, diseases, you know, symptoms, all of that. Some of them are similar, some of them look the same. It's very complex. We're not sure if it relates to this symptom or this disease or whatever, but sometimes you feel like you're rushed and you feel like the doctor isn't really paying attention to you. And so when you feel like that, you start to shut down, and that's me. That's how I am. I feel like if people don't listen to me, then I shut down, and I feel like my voice is being taken away in a sense. And so that's how I felt. But I also knew that I didn't want to live like this for the rest of my life, and I didn't want to. I was so young. I was only 30 years old. So to be 30 years old and for a doctor to say, this is what a 70-year-old woman would be going through. And I didn't want to hear that. I said, well, aren't there other women, other men that have been through this around the world? Can't we look and tap into other networks and see? And so then I went back to my primary care doctor and I said, can we find someone who, you know, is looking into this and researching this? And she was able to find a great doctor. His name is Dr. Keith Sterling. He's amazing. Unfortunately, now he has retired from medicine. He's doing more of like the research side of the house now, where he focuses on working with other companies. But he basically did a surgery that not many doctors, he might have been like one of the very first doctors that has even tried to do something in his field such as that. So basically he did an angioplasty and he was trying to break the clot and open up my veins so that way I could have some type of flow and it wasn't so constricted, because that was causing all of the swelling and the pain and the redness and all of the issues that I was experiencing. Fatigue, and when I say fatigue, I'm talking major fatigue. I've had a child. I know what pregnancy fatigue feels like. I know what having a child feels like. It was nothing like that. It was 10 times worse. And I felt so exhausted. Like after 2 hours of being up, not even 2 hours, 30 minutes of being up, I was like, I'm tired. I want to go back to sleep. I mean, that's how exhausted I was. And so he made it his mission to figure out exactly how I could have a better way of life and get back to some sort of normal, whatever that normal way of living was before. You know, I mean, I couldn't go back to running marathons like I did before, but I was able to run after he did the surgery that he did. So did the surgery. I did end up getting another blood clot while I was in the hospital, which is pretty rare because I was on heparin, which is a a blood thinning medication that's administered intravenously, which is very, very odd. But that gave them an idea that, you know, I needed to be on blood thinners for the rest of my life. So they were able to get the veins open. And then once they got the veins open, they inserted 4 stents that were custom made to me and made specifically for my body. So I had those stents placed, and it was like night and day. It was like a light bulb switched on, and all of a sudden my body felt like totally different. My leg was no longer swollen. I didn't have to wear compression stockings like I had to every day prior to, you know, having this surgery. After this surgery, I did have to have physical therapy again, which is something that they weren't really sure, were puzzled about. So that something that was unique to me is that after these angioplasty surgeries, I, for whatever reason, end up having to use some kind of assistance, such as a walker, cane, for a little while. But it wasn't as excruciating pain as it was before, and it wasn't as long as it was before. So I didn't have to go through the process, and I didn't have to go through physical therapy as long. So I did that, and then after I did that, it was awesome. Like, I could fit into pants again, and I could, you know, not have to wear certain shoes, and I didn't have to wear compression stockings all the time, and I didn't feel so tired all the time, and it was great. It was like amazing. So then after that, I went a couple years. Actually, I went 5 years without having to have surgery. So during that moment, you know, the only thing that they requested was, hey, Sarah, you need to make sure that you come see us every year just to make sure your stents are in place. We want to make sure that your blood flow is working correctly and everything's doing what it's supposed to do and that sort of thing. So the only time I went and saw them was, you know, every year, and did my yearly checkup, and everything was fine. So within that time, I think that that I was, you know, I was doing great, but then I had a major car accident where I was hit by a semi truck. Thank God it didn't affect me, you know, my blood circulation or anything like that, because I had it checked out immediately. But it caused me to not be able to run like I used to. So after the surgery, when I had Dr. Sterling, when he put the stents in, when he put the 4 stents in, I was able to run again. After back surgery, I haven't been able to run, or I'm sorry, I never had back surgery. After the car accident and my back injury, I've never been able to get back to running like I've been able to. maybe one day my body will get back to the way it was, but yeah, we'll see. So I had the stents in for 5 years. 2016 is when Dr. Sterling did the surgery. So in 21, let's see, 21, wait, yeah, 21. So 5 years later, there was some calcification of the stents, and I noticed that I started to have pain in my buttocks again. And he decided that I'm very good at knowing what's going on with my body. I listen to my body a lot, and at this point I know if something's going on. And so he said, okay, let's schedule a surgery because it looks like your circulation is not the same as it was before. And so they ended up inserting 2 more stents into my body in 2021. And I actually had no downtime from that surgery, which was pretty amazing. I was like in and out for that surgery, whereas before the other surgeries were pretty the other surgeries that I had before were long hospital stays. So he inserted the two additional stents. One stent that I have is a very large stent. I have one stent that is from my abdomen to the top part of my thigh. So that's one stent. It's a pretty large stent. I just went in and had my stents reviewed for my yearly appointment, and there was someone that was in my appointment for training, and he was able to observe and see, and one of the technicians said, yeah, we don't normally get these kind of patients that have stents like this, so when we do, we like to have people come in and train and see patients like you. So he came in and kind of saw the kind of stents that I have. So the amount of surgeries I've had related to DVT and pulmonary emboli, I've had 6, because I've had other surgeries for other things. I've had 6 surgeries, all in all. I don't know if I'm going to have any more surgeries. It's one of those things that you don't know. You have to play it by ear and have to see how you feel. I'm not gonna lie, I'm in pain all the time. It just, depends on the day and the time of day, and I've kind of lived with this pain. So, when the doctor says, are you in pain? Or how are you feeling today? It's usually like, I'm okay. Because, like my pain is something that I've dealt with for years, and it's not gonna go away. It's, my leg pain that I have, and my for my DVT. So that's just something that I have to live with. And then on top of that, I have back pain now from my car accident. So just learn to take one day at a time, and, you know, thankful that I'm able to be here for my daughter and spend time with her. And, you know, my biggest thing now is raising awareness so that others know what are the signs to look for a blood clot. So my signs were totally different. They're not what you would typically see. Like, some people would say I have signs like, my sign is pain in my calf area. Well, I didn't have pain in my calf area. I had no pain in my calf area. My pain was in my buttocks. And you don't hear that. You don't hear, like, I have pain in my buttocks. Like, people think it's a sciatic nerve pain. So that was unique to me, and probably unique to other people. I'm sure there's other people out there that have had blood clots that are, you know, similar to what I did, related to, you know, same pain, same idea. Like, I had pain in my buttocks area, same thing, same idea. You can be totally healthy, and I mean, I'm a healthy person on the outside. People look at me and they don't think that I look sick. On the inside, I have lots of things, you know. Since over the years, I now have autoimmune diseases I've been diagnosed with now. I have actually lots of autoimmune diseases. I have some allergies now, that I'm allergic to certain foods now. So I have to watch what I eat. And I also have some other things that I deal with on a daily basis. So, you know, and again, I was like only 30 when this happened. So, and you know, when you're a runner, you hear the idea that your blood is supposed to be thin. I tested for all of the factor V and all of the different genetic testing, and all of it came back negative. So I don't have any of those. I've asked the doctor plenty of times about that, and he stated that probably science hasn't figured it out yet. So there's, you know, maybe a chance that I might have something genetically wrong, but we don't know yet. So, you know, the fact that I got another blood clot is kind of odd, especially when I was on heparin. And yeah, it's one of those things you just take one day at a time, and you say to yourself, you know, you think you're lucky to be alive, because there's lots of people that, you know, aren't here today, and some of them aren't here because they went to the emergency room and they didn't have the typical signs, or they were young and no one believed them. And or, you know, it's not that they don't believe them, it's just that they're young, and so they're not looking at the signs that I was telling you about. They're looking at other things. And so you know, just trying to raise awareness so that people know what to look for is super, super important. And since I have started kind of researching it and connecting with others, I've met people that are young. I've met people that are my age, and it can happen to anyone. So you don't have to be like a smoker. You don't have to be on a plane and on a long car ride or any of those factors that are normally, you know, those are the factors too, but it could happen literally to anyone. But just raising awareness and making sure that, you know, we know who, what we're looking for when we go to the ER and we say, hey, I'm having this pain, can I get evaluated? And being able to advocate for yourself. I think that's the biggest thing. Like, how can I advocate for myself so that way I'm being heard. So yeah, I think that's the biggest takeaway to all of this, is us being able to advocate for ourselves and sharing our story, raising awareness and helping others so that way we don't keep losing family and friends to something that in the end could have been prevented.